This is Tetralogy of Fallot. So it's going to be seen with several things. We're going to have that overriding aorta, pulmonary stenosis, right ventricular hypertrophy, and ventricular septal defect. It's going to be seen one of our blue baby syndromes, so a hypoxic kiddo, cyanotic spells, harsh systolic murmurs, and increased hematocrit. And you're going to have you're going to have chronic hypoxia, so you're going to have more EPO, so you're going to have secondary polycythemia, a lot of red blood cells. So like a 6-month-old with cyanosis, tachypnea, respiratory distress, heart systolic murmur, it's going to be a pretty bad one. You're going to really notice it. Hematocrit 52%. CD4 platelet cells are normal, suggesting isolated red blood cell rise. Chronic hypoxemia would increase that EPO and secondary polycythemia. So here's our practice question. A 9-month-old baby has recurrent cyanosis after crying and a harsh systolic murmur. And so the answer is going to be increased EPO production due to hypoxia. So let's look at some potential trap answers and why they might be wrong. So decreased pulmonary dead space. So dead space is ventilated, but it's not perfused. So there's air there, but it's not perfused. And so if the dead space increases, then more alveoli are involved in gas exchange, and that would actually help with the oxygenation, right? So that would not cause hypoxemia or hypoxia or increased EPO at all. It's the wrong mechanism. And impaired postnatal lung expansion. So that's seen in pulmonary hypoplasia, like congenital diaphragmatic hernias. And you have a surfactant deficiency there. So in preemies, that can lead to neonatal respiratory distress syndrome. And this causes hypoxia right after birth, respiratory distress. It's not related to anything with a murmur. So this is like blood problems, the heart. It's not lung expansion. Also, our patient is 6 months old. He has a heart murmur. So it points us away from lung causes. This isn't going to be like a pulmonary hypoplasia. So it's not that. Decreased renal blood flow. So there we have, make sure we scroll down. There we have low blood flow. So the renal tissue hypoxia and then increased EPO. And that can cause secondary polycythemia, but it'd be localized to the renal cause and not global hypoxia. And this person has a congenital heart defect and not a kidney disease. So no signs of hypertension, no renal clues, just the wrong patient profile. Monoclonal proliferation of the erythrocyte cells. So polycythemia vera be a myeloproliferative neoplasm. That's a primary polycythemia. That's when the red blood cells made independent of the EPO. So labs would be like increased red blood cells, increased white blood cells, increased platelets, low EPO, right? Low EPO. Interesting. So it's seen in adults, not infants. And this is a baby. We're talking about a baby. So let's talk about these symptoms here. Pulmonary stenosis. That's why you have that murmur. VSD, overriding aorta, and the hypertrophy. It'll shunt. The blood shunts from the right side of the heart, right side, over here to the left. It causes less oxygenated blood that's reaching the lungs. And so then the body is going to detect that low oxygen, and the kidneys are going to be like, guys, we need some more EPO up in here. EPO stimulates the bone marrows, and it causes the red blood cells, and that gives us polycythemia secondary, which is increased hematocrit. So yeah, that's some Tetralogy of Fallot for you. Yeah, hopefully that was some good flow for you. Wow, that was just so bad. Anyways, don't like and subscribe. I'm embarrassed to ask.